chronic diseases such as heart disease and cancer. However, like any other beverage, drinking too much tea can have negative effects on your health. 1. Caffeine overconsumption. Drinking too much tea, which contains caffeine, can lead to caffeine overconsumption, which can cause a wide range of side effects. When caffeine is consumed, it can cause the release of adrenaline, which can stimulate the nervous system and increase heart rate and blood pressure. This can be beneficial in small amounts, but too much caffeine can cause these effects to become exaggerated and lead to adverse symptoms, such as anxiety, nervousness, and restlessness. One of the most common side effects of caffeine overconsumption is insomnia. Caffeine is a stimulant that can disrupt the body's natural sleep cycle and make it difficult to fall asleep or stay asleep. This can lead to feelings of tiredness and fatigue, which can have a negative impact on physical and mental health. Consuming too much caffeine can also cause gastrointestinal issues, such as stomach upset, nausea, and diarrhea. This is because caffeine can stimulate the production of stomach acid, which can lead to irritation of the gastrointestinal tract and cause discomfort and digestive issues. Anxiety is another common side effect of caffeine overconsumption. Caffeine can stimulate the release of cortisol, a hormone associated with the body's stress response. In high doses, cortisol can cause feelings of anxiety, nervousness, and jitteriness. To avoid caffeine overconsumption, intake is up to 400 milligrams for healthy adults, which is equivalent to roughly 4 cups of tea. However, this amount can vary depending on factors such as age, weight, and tolerance to caffeine. It's important to be aware of the caffeine content of the tea you're drinking and to monitor your consumption accordingly. 2. Dehydration. Dehydration is a serious side effect of drinking too much tea that can have negative impacts on your overall health and well-being. When you drink tea, especially in large amounts, it increases your urine production, which can cause you to lose more water than you take in. This can lead to a decrease in your body's water content, which is essential for many important bodily functions. One of the most common symptoms of dehydration is headaches. When you are dehydrated, your body lacks the fluid it needs to keep your organs, including your brain, functioning properly. This can cause headaches that can range in severity from mild to severe, making it difficult to focus and complete daily tasks. Fatigue is another common symptom of dehydration. When your body is dehydrated, it has to work harder to maintain its normal functions, which can cause you to feel tired and sluggish. This can impact your ability to concentrate, your mood, and your overall productivity. Constipation is also a side effect of dehydration caused by drinking too much tea. When your body lacks the necessary fluid to properly digest food, it can lead to difficulty passing stools. This can cause discomfort and may even lead to more serious health problems if left untreated. To avoid dehydration, it's important to consume enough water and other hydrating beverages to offset the dehydrating effects of tea. The amount of water you need depends on various factors such as your age, weight, activity level, and climate. As a general rule, aim to drink at least 8 glasses of water a day or more if you are very active or live in a hot climate. 3. Tooth decay. Tooth decay is a common dental problem caused by the buildup of plaque on the teeth. Plaque is a sticky film of bacteria that forms on the teeth and gums after eating or drinking. If not removed by brushing and flossing, the bacteria in the plaque produce acid that can dissolve the enamel of the teeth, leading to cavities. Tea is one of the beverages that can contribute to tooth decay. Tea contains tannins, which are natural compounds found in plants. Tannins are what give tea its color and flavor, but they can also stick to the teeth and cause stains. When combined with sugar, tannins can increase the risk of cavities by providing an environment for bacteria to thrive. Sugar is a primary source of food for bacteria in the mouth, and when consumed in excess, it can lead to tooth decay. When sugar is added to tea, the combination of sugar and tannins can form a sticky film on the teeth, which is difficult to remove even with brushing and flossing. The longer the sugar and tannin film remains on the teeth, the greater the chance of tooth decay. To prevent tooth decay from drinking tea, it's important to practice good oral hygiene. Brushing your teeth twice a day with fluoride toothpaste and flossing daily can help remove plaque and prevent the buildup of bacteria in the mouth. Drinking tea in moderation can also reduce the risk of tooth decay. It's recommended to drink tea without sugar or to use a sugar substitute to reduce the amount of sugar in your tea. If you are concerned about tooth decay or have noticed any discoloration or sensitivity in your teeth, it's important to see a dentist. They can perform a dental exam and provide recommendations for treatment and prevention. 4. Iron absorption interference. Iron is an essential mineral that plays a crucial role in the body. It's needed for the production of hemoglobin, which carries oxygen in the blood, and myoglobin, which is found in muscle tissue and helps muscles store and use oxygen. Iron is also important for the immune system, and it helps produce energy. However, iron deficiency is a common nutritional deficiency, and it can lead to anemia, fatigue, and impaired immune function. Tea contains compounds called polyphenols, which can interfere with the absorption of iron. Specifically, polyphenols can bind to iron in the intestines and form complexes that are not easily absorbed. This can be especially problematic for individuals who have anemia or low iron levels, as it can exacerbate their condition and lead to further complications. To avoid this, it's recommended to drink tea between meals instead of with meals. This is because consuming tea with meals can increase the risk of iron absorption interference due to the presence of other dietary components such as phytates, calcium, and casein, which also inhibit iron absorption. Therefore, drinking tea between meals can reduce the likelihood of this interference. It's also important to note that not all types of tea have the same effect on iron absorption. Black tea, for example, has been found to have a greater inhibitory effect on iron absorption than green tea. Additionally, adding milk to tea has been shown to decrease the inhibitory effect on iron absorption, likely because milk contains calcium, which can help bind to the polyphenols and prevent them from binding to iron. It's important to note that individuals who are at risk for iron deficiency should not rely on tea as a source of hydration, and should instead focus on consuming other beverages that do not interfere with iron absorption, such as water or herbal teas that do not contain polyphenols. Additionally, it's recommended to consume iron-rich foods such as red meat, poultry, seafood, beans, and leafy greens to maintain adequate iron levels. 5. Gastrointestinal issues. Gastrointestinal issues are among the most common side effects of drinking too much tea. Tea contains tannins, which are a type of plant compound that can irritate the digestive system and cause various gastrointestinal problems. These issues can include nausea, vomiting, diarrhea, and stomach cramps. Tannins are found in many different types of tea, including black, green, and herbal teas. While tannins can provide some health benefits, such as reducing inflammation and promoting heart health, consuming too much of them can have negative effects on the digestive system. One of the main ways that tannins can cause gastrointestinal issues is by irritating the lining of the stomach and intestines. This can cause inflammation and lead to symptoms such as stomach pain, bloating, and cramps. Tannins can also bind to proteins in the digestive system, which can interfere with the absorption of nutrients and cause diarrhea. In addition to tannins, Some types of tea can also cause acid reflux in individuals who are prone to it. Acid reflux occurs when stomach acid flows back up into the esophagus, causing a burning sensation in the chest and throat. This can be especially problematic for individuals with gastroesophageal reflux disease, GERD, as it can exacerbate their symptoms. If you experience gastrointestinal issues after drinking tea, it's important to take steps to minimize your consumption. This may mean switching to a lower tannin tea, such as white tea, or reducing the amount of tea that you consume each day. You may also want to avoid drinking tea on an empty stomach, as this can exacerbate its effects on the digestive system. In conclusion, while tea has many health benefits, drinking too much tea can have negative effects on your health. It's important to consume tea in moderation and be aware of the potential side effects. If you experience any negative symptoms, it's best to speak with a healthcare professional. Thank you for watching. If you found this video informative, please subscribe to our health, fitness, and nutrition channel for more informative content like this. Remember to also hit the notification bell to stay up to date with our latest videos. See you in the next video.